Without further ado, I'm just going to start the webinar for today. Welcome, everyone. We are from the Society for Cancer Advocacy and Awareness, Kuching SCAN. We welcome you to the 7th edition of our webinar series, which we have started since the very beginning of the Movement Control Order. We are very pleased today to introduce you Dr. Wong Jyi Lin, a respiratory physician at Borneo Medical Center, BMC. The topic that he's going to be discussing with us today is My Lung, My Health. That is the title. And what we can know about how to deal with this in times of COVID-19 pandemic. So the talk essentially is going to be about 20 to about half an hour. If you do have questions, I suggest you might want to get your pen and paper ready. So while he goes through the questions, I will be also asking him some arranged questions as well. So you can use that time to write or type your questions in our chat box. We are going to mute everyone during the presentation, but we will open it at the end of the talk itself. So before I give the microphone to Dr. Wong, let me introduce him briefly. As I mentioned, he is a respiratory physician. He works at Borneo Medical Center. His specialist training was done in Sarawak General Hospital. He is a fellow of the Royal College of Physicians, Edinburgh. He received his advanced respiratory training in Sabah and was gazetted as a respiratory physician in 2012. And Dr. Wong has been practicing at Borneo Medical Center for the past 5 years, and he is currently the only private full-time respiratory physician in Sarawak. So we're very, very lucky to have him today. So without further ado, Dr. Wong, the floor is yours. Thank you.
Okay, hello everyone. Can you hear me? Can I just check?
Crystal clear.
Everyone can hear? 50, they can hear? Yeah, if you can hear, just nod your head. Okay, it's clear, right?
Yeah.
All right, and you can see my screen? Can you see my screen? Yeah? All right, okay, so we start, okay? I start with, well, I saw this on the Facebook. It says here, it really amazed me that for a disease that is relatively new, we only knew it for about 3 months, 4 months, 5 months, it has millions of expert opinions. So as a disclaimer, I need to start first. I am no expert in COVID-19, yeah? I don't treat COVID-19, but I'm a respiratory physician. So I deal with patients with a lung disease. So it's very important because COVID-19 presents with lung problems a lot of times. Therefore, it's very important for us to know as a respiratory physician what kind of symptoms COVID-19 has and how they experience. So today, I'm going to try to share with you, okay, something about COVID-19, but mainly the main target of this talk is actually for patients with other respiratory illnesses. So it's not a talk about COVID-19, it's actually a talk about other respiratory illnesses, okay? Right. This is what we know about COVID-19. COVID-19 is caused by, I think all of you know, is a coronavirus, okay? It's a SARS-CoV-2 or severe acute respiratory syndrome, coronavirus version 2. So it is, the virus is actually a coronavirus. Now, coronavirus is a large family of viruses. There is 7 types of coronavirus that we know cause illness in people, okay? There's other illnesses or coronavirus that is circulating, yeah, among the animals that it doesn't cause human problems. Sometimes some of these animal coronavirus can infect people and then they spread between people. So when this happened, when the animal coronavirus spread among people, human beings, then you start to have some of our known severe acute respiratory outbreaks. So they will include the MERS-CoV that we know about, and also the SARS-CoV that we know about. Okay, SARS is actually the 2003 SARS. Okay, now with the version 2, which is the 20. Most of the coronavirus actually cause very mild illnesses. A lot of us, it's just like common cold. So it's not that all coronavirus cause deadly disease. Most of them cause common colds, right? So 3 coronavirus that we know a lot about, well, not know a lot about, but fear most. One is the Middle East Refugee Syndrome, or MERS-CoV, sorry. I'm just going to go back on the slide a little bit. The slide seems to jam. Can you still see? Okay, wait, let me just go back on the slide. I'm not sure why the slide is behaving like that. Okay, so I'm just going to, sorry about this. I don't know what's happening with the slides. Can you all still see the slides?
Yes.
See?
Yes. But it's moving forward though.
Yeah, it's going, just give me a while.
Yeah.
Okay, I think, let me just go back again.
Okay.
All right, okay, here we are. Okay, so the ones that we most fear about is the Middle East Respiratory Syndrome. We fear about that because there is an outbreak in 2012. It's associated with camel. And then you have the SARS-CoV. Slide in. I know it's very complicated, okay? But I just want to highlight a few things for you here. This is your SARS. Oh, again, hold on. This is your SARS-CoV, okay? So the virus, as you can see, I'm just going to move my mouse here. For the virus to infect a human being, first of all, the virus needs to be taken up by the human cell, okay? So you have the virus here taken up by a human cell. And I'm going to highlight this ACE2. ACE2 is a receptor that allows the virus to be taken into human cells. Now, why do we like to talk about this? Is because there are antibodies that's targeted this. That people are trying to build up antibody to target this to prevent the virus to be taken into human cells. Yeah. So that's why ACE2 is very famous. It's being used a lot. Now, okay, then once the virus went into body, then it will have to replicate. Yeah, the virus have to divide. And that's how the virus, they will produce RNAs that's taken up by the human cells, and human cells will produce proteins to replicate, to produce more SARS-CoV-2 virus, and then they will release into the body again, okay? So that is how a virus infects a person. It needs the receptor to get into your body, yeah? So now, this is the most common question patient with lung problem ask, because a lot of patients with lung problem, they always have this coughing. Coughing is very common for patients with lung problem. Difficulty in breathing, again, very common. So a lot of patients will be asking now, how do I know that I actually have COVID-19 and not anything else? How do I know that actually the symptoms are due to COVID-19 and not due to my regular, say, asthma or COPD, or how do I know? Okay, so we're going to go through a little bit about this. Actually, it is not just difficult for you to know whether you have COVID virus or not. It's difficult for doctors also. Sometimes we also don't know whether a patient has COVID because the symptoms are very similar to a common flu. Okay, it is very similar to seasonal flus. So I put this out because this is from China, and the reason why China study, because basically they are the first one to face this virus, so they have a lot of studies from that. So from the 44,000 patients that they have that they publish, 81% of the patients actually have very mild symptoms. Okay, they may have just a little bit of cough, a bit of fever. 14% of them will really have dyspnea, means a difficulty in breathing. Yeah, the dyspnea is difficulty in breathing, and there's I'm not sure why my slide keep on jumping, so sorry about that. I'm just going to put it back again. I'm not quite sure what's happening there. I'm just going to put it back, sorry. Okay, there we are. Right, so 81% of them very mild symptoms, just like cough, a bit of cough, maybe a bit of fever. 14% with difficulty in breathing, dyspnea, difficulty in breathing, hypoxia, difficulty, low oxygen. Okay, and then those the ones that are critical, the ones that read about in the newspaper, they were in ICU. Yeah. So not many patients, not everybody will end up with a very critical illness. Okay. So in China, the death rate is about 2.3%. So every 2 patients out of 100 will pass away because of the SARS-CoV-19. All right.
Dr. Wong?
From the studies also, okay. Yes.
Sorry.
Can you see me or can you hear me?
Yes, we can hear you, but the connection is a bit broken. There's a lot of noise behind you.
Yeah, I just don't know how I should do that because I also hear a lot of noise. What I'm going to do is I'm going to, let me try to leave the computer audio and see. Is it still very a lot of noise?
It comes when you are talking.
Okay, is it better now?
Yeah, much better now.
Yeah, I don't know what's happening, but anyway, let's try and see. Okay, is that better? That's better. Yeah, because I also hear a lot of noise somewhere, and they keep on jumping. I don't know why. Okay, now I just want to put this slide on. Hold on. Again, something is going on. This is okay. I just want to put this on. Okay, now majority of patients will have fever. So if you can see, 99% of your patients will have fever. You can talk about dry cough, you can talk about coughing, you can talk about feeling tired, but 99% of patients is going to have fever. So what does this mean? This means that if you suspect you yourself have COVID-19 and you don't have fever, then you are very abnormal. Yeah, you are an abnormal COVID-19 patient. So that's why we are measuring fever, we are measuring temperature, because most patients with COVID will have temperature. Okay, so the incubation period, what does the people talk about incubation period? Incubation period means if you come into contact with the virus, for you to develop the symptom, that's what we call the incubation period. It will probably takes about, we know, about 5 days, but it can range between 2 to 14 days. So that means if I come into contact with someone with virus, and then after 2 weeks, I still don't have symptoms, chances are you don't have COVID-19. Yeah, we know by 2 weeks, most people will have symptoms.
Yeah.
Once you have symptoms, within 5 days, you are going to have difficulty in breathing. Okay. Within 7 days, hospital. Within 8 days, you will be in big trouble.
Okay.
By 10 days, if by 10 days you're still well, then you know that your COVID is probably going to be very mild and you're not going to have problem. Okay. If you are going to have problem after you start to have fever and cough, within 10 days, you're probably going to end up in ICU. So 10 days is do and die. If you by 10 days you're still in ICU, you're still around, walking around, you're probably going to be okay. Yeah, is that clear? Yeah, okay, clear?
Yes, Dr. Wong.
Okay. All right.
What about lung cancer patients?
Yeah.
Would they be the most susceptible to COVID-19, you think? Lung cancer patients.
Okay, we'll talk. Well, I'm going to talk a little bit about who are at risk later on.
Okay. Okay.
Okay, but first of all, I just want to tell you that even though you talk about fever, coughing, actually your patient can have a lot of other symptoms. Yeah, not just lung. You can have diarrhea, you can feel nauseated, you can have headache, vomiting, and recently, okay, in UK they say there's change of taste, change of smell. UK published that, and then they start to put chills and rigors, or when you have chills. Okay, so there's a lot of symptoms, but 99% of them will have fever. Yeah. Okay. So by 10 days, like I say, patient will deteriorate if they are going to deteriorate. 10 to 15% will need ICU, and then the death rate is about 3%. Yeah. Okay. Now this is what Dr. Fiji is asking about risk factors. Okay. One of the risk factors is of course age. The older you are, the more at risk you are. Okay. So with this 80, when you're 80 years old, 14.8%. If you are younger, then your risks are less. Okay. This may not be true for all the countries. This is for the Chinese. Okay. We do realize that in some countries, there is a group of patients within the 50 to 60 years old group, yeah, who have quite bad disease. But generally, most people will say that as you age, you are more at risk. Okay. Who else is at risk? Well, there you are. Again, sorry about this. I'm just going to move my mouse slowly. Okay. Heart disease. So if you have heart disease, you have a 10.5% chance of death rate. Okay. Remember, I say generally the death rate is about 2 to 3%. Okay. If you have nothing, your death rate is about 1%. If you have cancer, you have about 5% chance. If you have chronic lung disease, or you have your asthma or COPD, is about 6%. So for someone is 1%, then you have 5 times the risk if you have cancer. But if you have heart disease,
yeah,
you have a 10 times risk. So do not think that you have no lung problem, therefore you are okay. Yeah, actually the person who is the most at risk is going to be the ones with the heart disease. Okay. All right. So
sorry, the cases
yeah.
I've seen, I think in the UK now, it seems like the number of children getting COVID-19 is much higher than other countries. Yeah.
So you, okay, I just there's a bit of interference. I just make sure you're asking about children, is it?
Yes.
Okay. Well, the good thing about the COVID-19 is we know that the children's, yeah, even they develop the symptoms, a lot of them are quite well. A lot of time you thought that they probably just have flu. The parents probably thought that they just have flu. But studies have shown that if the children, even though the children just have mild symptoms, they are infectious. So when if you're looking after, if you're worried about COVID, one of the things that you can ask yourself is, do the children at your home, anyone at home, especially children who have flu, if they have, then you should be careful because there could be coronavirus. Yeah, but they don't develop. So the children's luckily they don't get into very ill conditions a lot of times. But the problem is, if they have, they are infectious and they may affect people who are more at risk. Yeah. Okay. So the key I want to bring home for this is look after your chronic illness during the COVID-19. Okay. So a lot of people seek medical help early. A lot of people, oh, yo, it's now COVID-19. I better stay home. Yeah. So they run out of their diabetes medication. They run out of their heart medication. They are MCOs or stay home, no medication. Yeah, their asthmas are not well controlled. They have some symptoms. They may have chest pain, but they avoid going to see doctors. Why? Because they worry. They don't want to go out. So the key I want to bring the message to you is look after your chronic illnesses. Look after them. Take your medicine. Go and see your doctor if necessary. Okay. All right. I'm going to skip to that. Okay, I'm going to skip to this and go on and say that the other person who are at risk, of course, is the smokers. Okay. Now, the smokers, there is no real evidence that says, look, if you smoke, you're more likely to get COVID.
Yeah.
But then we know if you smoke, you damage your lung. If you have a poor lung, if you get COVID-19, you're more likely to end up with bad diseases. Okay, but the key is this: smoking and vaping increase the spread of COVID-19. Because you can imagine if you take a smoke and you exhale and you see all the smoke come out, you can imagine if you have COVID-19 there, well, it's just going to spread. Some people will argue that the smoking is going to kill the virus. Not that we know of. We don't have any evidence to say that. Okay. In fact, WHO will say, better don't. Okay. There is no evidence that smoking is going to protect you.
Yeah.
There's no evidence of that. Yeah.
There's also some news flying around saying that nicotine can actually kill coronavirus. Is that true?
Can you repeat that just quickly? Say again?
Nicotine. Is it true that nicotine in cigarettes can kill coronavirus?
Yeah. Well, I must say no. We don't have any evidence on that. No.
Okay.
Yeah. We don't have any evidence on that. Okay. Okay. Now, if you have lung problem, okay, most people with lung problem or even cancer patients, one of the questions that we always ask is, how do I protect myself? Correct? I know I have, I do have illness. How do I protect yourself? Now, this is one of the questions that when the Chinese doctor came, when they come and share, one of the questions that people ask the Chinese doctor is this: we know that how do you improve your immune system? Okay, there are people who suggest vitamin D's, vitamin D's, probiotics, vitamin C's. During the COVID-19, vitamin C is run out in pharmacy. Everywhere you go, nobody's have any vitamin C left. Okay, so I think the Chinese doctor reply is quite good. I agree with him. So what he say is, it is better to have better personal protection, healthy living and eating habits, and stay active. So far, we don't have any clinical literature that says the medication can be effective. Okay, so there's no miracle drug that can help COVID-19. There's no evidence of large dose of vitamin C, vitamin D, probiotic that is helpful. We don't have any of that. So if you are hoping for a lucky, quick advice on what drug to use, unfortunately, there's none. Okay, you can try anything you want, but there's none.
Dr. Wong, what about people?
The next slide is yes.
Dr. Wong, what about people who take flu jabs, the flu vaccine? Does it work?
Okay,
the flu jabs.
The flu vaccine protects you against influenza flu or seasonal flu. Okay, remember I was saying that. Remember we were talking about. Remember we were saying that. Don't forget COVID-19, and they somehow forgot that there is common flus running around. There is seasonal flus running around. Okay, wait. Can you see, or something is went wrong?
Yes.
Something went wrong. I'm just going to open the slides again. You hold on, huh?
Yeah.
So a lot of people so overwhelmed by COVID-19, they forgot that there is a lot of other illnesses in the world. Seasonal flu is one of them. Every year, seasonal flu kills thousands and thousands of people. So the flu jab doesn't work for COVID-19. But what does the flu jab work? It helps protect you against seasonal flu. Yeah. So if you are protected against seasonal flu, at least you know when you come with cough, with fever, if a doctor know that you have a flu jab, then we know at least this is probably not seasonal flu. Probably we have to look for other causes rather than to worry about seasonal flu or to worry about other things. And that's the reason why the influenza vaccine are very important in COVID-19. Not to prevent COVID-19, but to prevent other illnesses that can make COVID-19 worse. Yeah. Okay. Now, this is one thing that I find very interesting. Okay, we're debating about this, talking about among respiratory doctors recently. Now, in April 2020, people talk about this iodine. You know what is iodine? Iodine is the yellow color disinfectant that people use on wounds and all that. Okay, iodine is very common. And people has talked about using the iodine as a nasal spray. So you have an iodine and spray into the nose. or you can use it as a gargle wash, you know, like you put a soap water wash. You can use iodine wash during the COVID-19. And I quote you this little study in April 2020. And then let's see, okay. So first of all, of course, if you spray something inside your mouth, you need to know whether it's safe or not, right? So they find that it probably is safe if you put it into the nasal cavity and mouthwash. And in fact, they recommend that you should use mouthwash in 2 reasons, okay? One is you want to reduce the viral load in 2 of the key areas where droplet and also contain the virus are aspirated. So that means you know that people who sneeze and cough is going to spread the virus. And where did the sneeze and cough come from? It's from the mouth and from the nose. So if you can clear the nose and mouth of the virus by using iodine, then when you sneeze and cough, at least there's not much virus coming out. That will reduce your infectivity, okay? Then, of course, the other thing is, of course, is for the healthcare workers, for us, we would like our patients to spray their mouth first, because then when they come and see us, okay, when we do procedures, then at least there's not much virus inside there, okay? So that is a povidone iodine. Right. So of course, they say that, okay, now this is an in vitro study. In vitro means they put the iodine and see whether the virus dies. They don't really have evidence that if you put into human beings, they can reduce their spray. Nobody dare to do that. Nobody dare to say, I spray my nose with iodine and then I get someone with COVID-19 to spray the virus, to spray the iodine in my nose and then go and cough in front of me and see whether I got COVID-19 or not. Nobody dare to do that. So they have to do the assumption on that. Okay, but having said that, it is probably quite safe to do it. Yeah. So there's not much harm. So why not? Yeah. Okay, so after this study come out, in fact, people who are business mind immediately, Melbourne company create nasal spray for coronavirus straight away. Yeah. Okay, so there's the iodine spray in the market for it. But Malaysia, I don't think we have the nasal spray yet, but we do have the oral wash in the market at the moment. Okay, whether this thing works or not, well, we have in vitro data. That means you have some data, but you don't have human to human trial. Nobody there to do that trial at this stage. Okay. Okay. So if you don't have any drugs that you can help, then the most important, of course, is personal protection. That's what we call PPE. You all read about PPE in the newspaper, right? Personal protection equipment, PPE. Okay. So what are the personal protections that can help? I think this is the most major debate, right? Some people say no need to wear mask. Some people say must wear mask. Some supermarkets say no mask, no ink. Some supermarket, never mind. Wash your hand and come in. So what is correct? What is not correct? Why people say, some people say need mask, some people say no need mask. Okay. Now, we know how it's spread. You know it's spread by respiratory droplets. Respiratory droplets means whatever you cough out, yeah, the saliva that cough out, your nasal thing that cough out, okay? And it's spread by fomites. Fomites are contaminated objects or surfaces. So if I cough, and whatever you spread out got onto the table, then the table is now possible infection, okay? So these are 2 ways how it's spread. One is I cough directly in front of you and you ingest or you inhale my cough. Okay, or I cough it onto the table and your hands go and touch the table. Okay, these are the 2 ways. So like I said, why people say no need to wear mask? Why initially we say don't wear mask? Because I think the experts are mainly worried of this false sense of safety. Okay, if I wear mask, I'm not going to get COVID-19 anymore. If I wear mask, I can go anywhere. I can talk to anyone because I wear mask. These are the things that we really worry about if we ask them to wear mask, because people wear mask, then they forget. Mask doesn't necessarily prevent you from getting the COVID-19 from someone else. Okay. Now, mask is actually to protect others from you. If I cough and I have a mask in front of me, then I don't cough to others, but it doesn't protect you. But a lot of people forget that. But a lot of people say, I wear mask, I won't get. Yeah. So that is one thing that experts worry. Say everybody wear mask, then everybody start to go out, everybody start to that one. Okay. The other concern is if you wear mask, you will know very uncomfortable. If you wear mask, what do you usually do? You need to pull out a little bit, itchy here, touch here, touch here. So you tend to touch your face more. And if you touch your face more, mask is dirty, you go and touch it, you just sneeze, you just cough, it's dirty, you go and touch it, and then you put your hand onto the table. Then the table is now contaminated. Okay, so mask is only effective when they are used in conjunction with hand washing. Every time you touch your mask, wash your hand. Yeah, okay. Yeah.
What about those, sorry, Dr. Wong. What about those who are, I see a lot of people going out wearing gloves now. You know, when you go to supermarkets, people are actually putting on gloves and they're touching everything. Is that also giving us a false sense of safety, like what you said?
Yeah, definitely it's a bad idea. I'm going to talk about glove later, why you want to wear glove, but you can imagine, I cough, I have glove, I touch here, I touch the table, then I go and touch my supermarket, touch here, I touch my friend's bag, and I touch, your glove is the source of infection, So be careful with glove. But I'm going to talk a little bit about the glove later, okay? So I just show you some studies, okay? They study about 10 subjects. Basically, they found that an average 16 times per hour you need to touch your face. In fact, I'm doing this. I'm trying to consciously time myself not to touch my face in front of the video so that you all see me touching the face. Yeah, you all remember some of the politicians when they first started, they are caught touching their face many times. It is a natural response to touch your face. Okay, so another study, in fact. We study medical students. They are supposed to know more, right? They are supposed to be more smart than normal people, but unfortunately they touch more, 20 times, 3 times per hour. And go and ask the doctors. We are not smart at all. 19 times an hour, so we keep on touching our faces. And that's why wearing mask is even worse, because now itchy. Now you get to touch more. Okay, so it's a habit. It's a habit. So how do you break that habit? Okay, here are some of the suggestions. One is be mindful about your intention to keep your hands away from the gland. So always remind yourself, don't touch. Like during this presentation, I keep on reminding myself, don't touch my face. Don't touch my face in front of the video. Everyone will see it, Okay? And then you put a post-it notes. Of course, you try to remind yourself. But the best is keep your hands busy. Yeah? You see why the slide keep on moving? Because I put my hands on the mouse. I try to remind myself not to touch the face because my hands is on the mouse. Okay, so you're watching TV, try folding laundry, do something so that your hands don't touch your face. Yeah, okay. Of course, you put a hand sanitizer. So there's a lot of a nice smell hand sanitizer that you put. In fact, you should put some that is smelly, because the moment your hands are smelly and you try to put near, okay, you can smell it already. So you remember, don't touch it, you smell it. Okay, so make that a habit. Okay, and of course, if you're in the meeting or sitting in the class, put your fingers together like this so that you don't touch it. And finally, you can consider wearing a glove, because you wear a glove, you remember every time you touch it. You remember, you see the glove. Don't touch, don't touch, don't touch. So the glove is not to protect yourself from something, but it's just to remind yourself, okay, don't touch your face, don't touch your face. Okay, so so that is some of the suggestions that you can do. But I think most important is just constantly remind myself not to touch the face if possible. Okay. Yeah. So in summary, for
Dr. Wong,
protection, should you wear? Yes.
Dr. Wong, can I ask a question? So I was watching I was watching a video by Dr. Sanjay Gupta on CNN or CNBC. So he was also showing people how to, that you really need to wipe down your grocery that you bring back from the supermarket, and if you don't need them immediately, you can leave it out in the car porch for a while, let it sit there, and all that. So we're talking about people wearing gloves, touching here, touching there, cross-contamination. So you would expect things you buy from the supermarket, whether they come in the package or otherwise, to be contaminated as well. So when you bring home, do we have to wipe them down? I mean, I do.
Well, yes, let me see if I understand you. So when you buy things back home, do you have to wipe them down? Is that right?
Yeah. Like my milk cartons, my soap, and whatever my bottled oil, you know, now I wipe them down and leave it out for a while before I bring them in.
Yeah, yeah, I know. Yeah.
Mm. What do you think about that?
Okay. From the total point of view, yes, you should do that if you can. From practical point of view, I can tell you, yeah. Sorry. Okay. From the practical point of view, can you hear me?
Yeah. Can you repeat that?
You can, huh?
Can you repeat that, Dr. Wong?
Okay, can hear.
Yes.
Huh?
Can you repeat, Dr. Wong? Can you hear us? Dr. Wong? Oh dear, I think we have lost him for a bit. Let's give him a few minutes to reconnect.
Perhaps we can ask him to use the 4G rather than house Wi-Fi, because now Unify, sometimes it got on and off, on and off.
Yeah, that's quite true.
Dr. Fitri, let me call him.
Yeah.
Let me.
Well, we can use this time to type questions in the chat box. If you have anything that you would like to ask. To the person who was asking about the cleaning or sanitizing the groceries, may I have your name, please?
It's Grace Lily from Scan.
Hi, Lily. Hi, Lily. Sorry, I didn't pick up the voice.
No, it's okay. No worries.
I do that all the time as well, Grace.
Yeah, because he's talking about cross-contamination at the supermarket, right? So it makes sense, right?
That's true.
I think he's back.
Yeah. Brilliant.
But you need to ask him to repeat what he was going to say.
Yeah. And none of us caught it, actually.
Yeah.
All right, I'm back. Can you hear me?
Hi, Dr. Wong.
Okay, this is much better. Just now there's a lot of interruption. I'm not sure. Can you hear me now?
Can hear you, but cannot see you.
Okay, I'm going to show my video. Probably is if I show video, then it may delay. Okay, is that better?
Yes.
All right. Okay. Sorry about that. So, what do you need me to repeat just now?
Oh yeah, there was a question about sanitizing the groceries, basically.
Yeah. Okay. Yes. I mean, yes, you should do that. But I can tell you from practical point of view, I try to do that all the time. But practically, you just cannot sanitize everything. So you try your best. Okay. Everything that you buy back, remove it from the plastic with a clean hand, and then discard the old plastic and put it into a new container. Okay. But again, for sense of security, never feel that it is safe just like that. You always practice, you try your best to practice personal protection, but then you still have to be careful. Yeah. So yes, certainly I think that you should, whatever you buy back, you should leave the plastic bag and then remove it and put it into something else. But I think the most important still is try to prevent people touching the stuff in supermarket. That is the most important. Yeah. Okay. All right. This is much better now. I can hear you quite well. Okay. Now, So wearing a surgical mask do not protect you. Remember that, okay? It protects other people from you if you're coughing, okay? So do not have that false sense of security. I wear my mask, it's okay. It is not okay. The best personal protection is social distancing and wash your hand all the time, okay? And you touch something, wash your hand. You touch something, wash your hand. Okay, they are the ones that last longer. So there's a hand sanitizer that can last 4 hours. You can smell the smell on your hand, yeah, a lot of times. But social distancing are very important. I always say that a lot of times we are so preoccupied with this that we are so, how do we say, extreme with this, okay? You will never be able to forever shut yourself down from the rest of the world. Just like MCO, it's never going to work. MCO is not going to last forever. Yeah? The key with all this is always remind yourself about social distancing and try your best. Yeah, try your best, but you should not let it such that it affects your life. Like I say, if you are not well, do not say I'm going to stay home because I don't want to get COVID. I don't want to go out. You still have to go out and seek help. You still have to go and buy your medicine. I think that is the key. Yeah. So, well, I touch my hand. I touch my face again. You know. Okay. I'm going to consciously control myself. Okay. So basically, okay, I'm going to summarize. Okay. COVID-19 is a new disease. There's many things we still don't know. Okay. We don't know why some people will have bad disease, why some people so healthy and yet they die from the disease. And there are people who are 90 years old who survive without problem, who don't even know that they have the disease. Why some people can spread, why some people don't spread. A lot of things we do not know. And I always, I put the thing here because I also want to remind there is many other diseases that we don't know out there. Yeah, 10 years ago you have the SARS, then you have your MERS-CoV, then you have your bird flu. How do you know it's not going to have another one? Yeah. So the message I want to bring is do not be so preoccupied with COVID-19 that the rest of the world is all about COVID-19. There is many diseases out there. So hopefully once the COVID-19 is over, we still do not forget about social distancing, personal hygiene. So when you cough, you still don't want to cough in front of your hand. You still want to prevent the droplets from going. You still want to remember how to wash your hands. And you still want to build up your own body strength and coping ability to stress. Yeah, the Chinese doctor, I remember, the Chinese doctor, when we asked them, now I have COVID. Doctor tell me I have COVID. What should I do? The Chinese doctor was saying that for their Chinese patients, these patients, when they first arrive and they first feel sick, the moment they have cough, what happens is they are going to be quarantined. So they will spend the whole day in the hospital, getting pushed from here to there, to one department, to another department, go and see the doctor there, check your temperature, go and take blood here. So the whole day they will be moving around doing swabs. Then they will be quarantined. Once they are quarantined, they come into this room. They don't know anything about the room. There's no food. They are tired. They don't rest. And then they worry. So you can imagine after 2 or 3 days of this, they fall sick. So by 5 days, they end up with very big illnesses. They are very sick. They are in ICU. And he hypothesized that this is always because you are too stressed. You are too tired. You don't get enough rest. You are not eating well. You are not getting your nutrition food. So he said, build your own immune system. When you're sick, when you're unwell, make sure you have enough food. Force yourself to eat something. Make sure you have enough rest. You don't want to stress. You don't want to do things that are unnecessary. Rest well, eat well, social distancing, that are very important. And this applies not just for COVID-19. This applies 10 years later. There may be COVID-19 SARS version 3, version 4. The disease will always be with you, okay? And the other key, of course, is do not forget is keep your underlying chronic diseases well controlled. You certainly don't want your diseases to be unwell. So you don't want your diabetes to be very high. You don't want your asthma to be poorly controlled, and you don't want your heart problems not well controlled. Always keep your medical illness under control, and that is the key. That keep yourself healthy. Make sure you look after your chronic illnesses during the pandemic. Okay. So to end, I put this slide up for those of you who really worry about your lung problem. I'm a lung doctor, so I can only help you with your lung problem. So if you worry about your lung problem, you don't want to come out, you don't want to come to Borneo because who knows, there's COVID in Borneo, you don't want worry about going to GH, then you can always call us and get an online consultation just like now. The quality may not be so good, we have problems with it, but then at least we can have a look and maybe decide whether there's something that we can do about it without you coming to hospital. Well, whether we need to come to hospital. If you have to come to hospital, then we're everything ready so that when you come, you don't wait for too long. You have all the tests done. Okay, so I think the new norm is going to be a lot of things. It's going to be internet. It's going to be online. And I think with meeting like this, what Scan do is very good because we're meeting like this. Hopefully, it's just that I know we still have a little bit of an online problem. I'm still trying to get used to using Zoom. So hopefully, is as we get better, things will get better. Yeah. Okay. So that would be my last slide, I think.
Okay. Thank you, Dr. Wong. Very, very informative, and it's really good to see that BMC is also putting up online services now to help potential patients even before we get to the hospital. I think this is a crucial step forward to what do you call it? Minimize, yeah, the risk.
Yeah.
I have some questions here, if you don't mind.
Yep.
There's someone asking about BCG vaccination. You know, in Southeast Asian countries, most of us we did get BCG at some point in our lives. Do you think that is actually helpful in terms of you know, decreasing the risk of getting COVID-19?
Yep. When it first come out, everyone has high hope. Okay. But then if you think about it, a lot of us has BCG. So if we have BCG, one would expect that Malaysia will not have COVID-19. And yet Malaysia still have COVID-19. Yeah. So obviously BCG is not all protective. Is it really protective? We don't know. Okay, there's not enough studies to say that it's definitely protective. There may be some people who believe that it is protective. It may be true, but we need more studies. But I think we cannot depend on BCG and hope that after BCG you won't get COVID-19. I think that is no, because Malaysia we have, and most of us have COVID, have BCG. So unlikely BCG is that helpful at this stage.
All right. Yeah. I have another question. How vulnerable am I as a cancer survivor with history of pneumonia, which periodically becomes asthmatic?
Okay. Well, first of all, the pneumonia hopefully is over. You don't have pneumonia anymore. Okay. Now, if you see the slide I have just now, if you have cancer, you're probably about 5 times the risk of normal people. So about 5% chance of you getting severe diseases. Okay. And then if you have asthma or chronic diseases, probably you also going to have about 6%. Yeah. So yes, you are at increased risk of a severe disease. Okay, if you get COVID-19, but well, protect yourself. Protect yourself with all you can. Wearing your mask. Avoid going out if not necessary. And get your underlying disease control. So get your asthma control. I hope you are on your inhalers for your asthma. Okay. And of course, get your cancer control. Work closely with your oncologist.
Good. We have a question in the chat box from Siu Hong.
Okay.
Her daughter has allergic problems due to her allergy. Just a minute. Due to her allergy to house mites. And she tends to have runny nose and cough in the morning, especially when after exposed. So she takes antihistamine to help reduce it, but would she be someone that would be more susceptible to COVID-19?
Okay, presumably she just have allergy, rhinitis, nose, but she doesn't have any asthma. Yeah. I don't have any data. I don't know whether I don't have any data on people with allergy, rhinitis, are they at increased risk. But logically speaking, when the COVID-19 first attack, it usually is in the nose, and then it get into the lung, to the nasal mucosa. So if your nasal mucosa is not intact because of allergy, rhinitis, then one will assume that yes, the virus may get into your lung more easily. But I don't have any concrete evidence or data on that. Okay, and then certainly if you have allergy, rhinitis, I think the most difficult thing with this is how do you know whether this is COVID or this is allergy, rhinitis? Yeah. And one of the things, like I say, is if you have fever, you have to be careful. If you don't have fever, we know people with COVID will have fever. So if you do not have fever, then I guess you are a little bit more reassured. Yeah.
Good. Jeffrey, are you still here? Do you want to unmute yourself and ask Dr. Wong your question? Jeffrey, are you there?
Hello?
Yeah,
Hello?
yeah, Jeffrey. Yeah, I can hear you, Jeffrey.
All right. So I want to know, how is it possible for a person?
Yes.
I think we lost him.
Okay. Yeah, it's so new technology always come with new problems. Jeffrey can text. You can text. You can chat. Yeah, you can chat it, and then we can read your chat. Okay. Can a person get positive without showing any symptoms? Yeah, this is so difficult. Okay. All right. Okay. We know they are asymptomatic carriers. Okay. It is not a lot. Okay. I think the most country, the study is about 0.3 to 1%. Okay. A lot of this, what we call asymptomatic patients, are not really asymptomatic with no symptom, but they're just a mild symptom. Remember, 81% of COVID-19 with mild symptoms. So you might have a bit of runny nose, a bit of sore throat. You thought probably nothing. You don't even pay attention to it. So there's a lot of report of people who have no symptoms, swab positive. Actually, I think some of them, if you go and ask, they probably have mild symptoms. The real true no symptom and no, up to now, I think most countries report them less than 5%. Okay, less than 5% of people who have swab positive and yet no symptoms. Of course, you can argue sometimes your swab can be wrong. You may be contaminated by something else. That could possibly happen. But I suspect most of these patients that are asymptomatic actually have some symptoms. Okay, the ones that are always worried is the ones that haven't developed symptoms. So when you do the swab, they have no symptoms. 2 days later, they start to have coughing. Yeah, these are not asymptomatic. These people have symptoms. It's just that they haven't developed symptoms. And these are the people that are potentially going to spread to other people. Yeah. So the real true asymptomatic means for 14 days, I have no symptom. I swab myself, it's positive. 14 days are no symptom. That one, not many, less than 5%. Yeah.
Okay. We have one question from Jakarta, actually.
Yep.
What is the formal protocol for COVID? Is there any standardized medication? Especially for me, I have had cancer. I don't know how to pronounce this.
Bleomycin, chemo.
And check radiation. And
okay.
Yeah.
Okay, Prabhu.
Process.
Okay, it's Prabhu from Nusantara. Okay. I think if you're asking me what is the formal protocol of cure for COVID, how to treat COVID, if I know, I will be famous already. I don't think anyone will know how to treat COVID at this stage. There's many drugs that are being trialed, like the recently approved Refugee, and then you have a lot of transfusing other people's blood. a lot of things are being tried at the moment. We don't know how to treat. My answer to you is prevention better than cure. Prevent yourself getting COVID-19. Look after yourself. Protect yourself as much as you can. Yeah, that is the most important. And of course, keep yourself under control. Keep your pulmonary fibrosis under control at this stage. Work closely with your oncologist. That is the only thing that I can think of at this stage that may help. If you do develop COVID-19, do not worry. Yeah, because like I say, most people, they are mild. The more worried you are, the worse it's going to get. Eat well, sleep well. And the rest, I think we leave it to God what will happen. Yeah, yeah. So that's the most important. Most people, once they get COVID-19, emotionally stressed. I have patients who cry, has been in hospital for 3 weeks already. Miss the children, miss the family members. That's not good for you because emotionally stress is not good for your body. Your immune system is even down. Yeah. Okay.
There's one question from Christina here, very quickly. I think we're reaching our 3:30 mark already.
Yes, yes.
She says, can you give a comment on COVID-19 risk from taking food and drinks that are ordered from outside?
One is well, I don't have a formal data. I don't have formal studies that says that you get infected from taking food outside. Okay, I don't think anyone has published any data on that. Okay, but like I say, we're not talking about COVID alone. With COVID are other things. When you tapao food from outside, you always be careful. One is you make sure that they are well cooked. Of course, you tapao from places where you trust their hygiene standard. Okay, if you don't trust their hygiene standard, then of course you have someone who is cooking, and while they are cooking, they are rubbing their face, they are coughing away, or they are having their cigarette while they are cooking. I don't think you want to buy food for them. Okay, once you buy your food back, of course, like we say, take out your food, tapao food, put it into a new plate. Okay, so before you do that, you wash your hand first. After you wash your hand, make sure your hand is clean. Okay, take out the food, put it into a clean plate, put the dirty thing away, wash your hand again. Okay, wash your hand again, then throw away the whatever left over, wash your hand again. Then you come back, then you can enjoy your food. I mean, that is the things that you can do to try to prevent, but I don't think anyone has any study that says that I drink water from outside and got COVID. Probably not. Probably not.
Yeah, I've got one last question here from I think one of our friends who had cancer.
Okay.
She said my left saliva gland has been affected by radiotherapy, so it's always dry. It makes me prone to coughing. Once I get that irritation, it becomes a real bad cough and become a full-blown cough for weeks. That's when the asthma would start. How would I prevent myself from this?
Well, talk to your ENT doctors, see whether there is any artificial moisturizer they can use. If the mouth dryness is the problem, then I think there's moisturizers for the mouth that you can use, artificial moisturizers. If you do have asthma, then you should use inhaler. Okay, you should use inhaler to try to prevent asthma from happening. Okay, so it depends what is the reason for the cough. It's due to dryness. Keep your mouth moist by using artificial moisturizers. If it's due to asthma, you should control your asthma. You should use inhaler to control your asthma. Drink lots of water. For people with asthma medication, sometimes they also complain of dry mouth. The way we deal with that is we say take lots of water frequently, keep it moist. Some people use steam inhalation, although I don't have any data on steam inhalation. Some people find that useful. Okay. But yeah, if the problem is salivary gland dryness, then talk to your ENT. I think they have artificial things that they can help you with in terms of moisturizer.
All right. Thank you so much, Dr. Wong. This has been a very, very interesting and engaging presentation. We definitely learned a lot from you this afternoon. I hope you'll come back again and have a chat with us in our upcoming webinars. Certainly informed us what other things that we can do to keep safe and to stay healthy.
Yes.
Thank you, ladies and gentlemen, who
Thank you, everyone.
Yes, who have come and joined us this afternoon. We will announce our upcoming sessions our webinar sessions in our Scan Facebook. So keep an eye out. If you have not liked us yet, please subscribe and like our page. I think that's it, Dr. Wong and everybody.
Okay. Thank
Stay
you,
home.
everybody. Thank
Stay
you.
home, stay safe. Don't touch your face.
Yeah, I always
Thank you,
remind
Dr.
about my
Wong.
hands on the mouse. Okay.
Thank you very much. Thank you.
Okay. Thank you,
Enjoy the
everyone.
rest
Have a
of
great weekend,
Bye,
everyone.
everyone. Bye. Thank you, Dr. Wong.
Thank you.
Thank you. Bye.
Ayat-ayatnya bahwa wajib dari Allah pada umat Islam yang beriman. Jadi dasarnya memang orang yang sudah.
Okay, thank you everybody. I think that
Puasa karena saya tidak. Saya berpuasa karena saya melaksanakan